Hello, everyone, and welcome to Compassionate Conversations. I'm Tanys Coughlan from My Place Homecare, and I am joined by my co-host, Heidi Gagne.
Hello.
Hey, Heidi. And we are so honored to have Anita Comfort with us today.
Hey there.
How are you, Anita?
Good. How are you?
Good, thanks. So maybe you can tell us a little bit about what you do.
By profession, I've been a nurse for 31 years. I have my hands in quite a few pots. My main job is I am the perinatal coordinator here at Wabano Center. In the evenings, I teach PSWs. I'm a nurse consultant for My Place Homecare, as well as a few other places, and I'm a legal nurse consultant.
Awesome, thank you.
So I was actually reading up on what a legal nurse consultant is. Could you kind of give a little more detail on that? Because it's quite intriguing to think that you guys are out there.
It's
used more in the States, but I mean, attorneys need us here in Canada as well, obviously. Mm-hmm. So what I do is if somebody has been hurt or if there's been a bad outcome, say in a hospital, for example, I do a lot of obstetrical cases, so I'll just use that as an example. If a baby is born and there's been a bad outcome and the family decides to, pursue a lawsuit, I go through the medical records and I find out what was done below the standards of care or against best practice guidelines. And I help the attorney, if I'm working plaintiff, I help the attorney build a case for their client. If I'm working defense, I just make sure that the nurses have worked at the standard of care and have used best practice guidelines in the care that they've given.
Okay.
And I can be an expert witness as well, so I'll take my report to court if need be.
How'd you get into that?
My mom died an untimely death in 2005, and my family needed closure. So I went through her medical records, and she died of strep A, and you can't really prove where strep A comes from. Although if I knew then what I know now, I would have worked a little harder at it. But hers was the first medical records I went through, and it just grew from there.
Wow. That's an interesting thing. I've never really thought of that as I never knew where medical experts kind of came.
That's where we come from.
Yeah, that's
from the field.
Right?
Yeah.
It gives family closure. Even if there's no merit to the case, it gives family closure knowing that everything was done that could happen. All doctors, all medical professionals say we did everything we could. Well, medical experts are able to let you know that is actually true. It helps that I'm nosy too, so I like going through medical records.
Well, it must be fascinating.
Yeah, it's interesting.
To see, especially when you can sort of picture what's happening, I guess. I mean, being a nurse, you've done it all. So, you've done all of the stuff for the client.
Yes, I've seen a lot.
So you can kind of picture, oh, they did this. Okay, that would have been like this.
Yeah, I've seen a lot
of that.
Mm-hmm.
Yeah.
Now,
so I do.
Sorry, go ahead.
I do long-term care home, like nursing home, personal injury, class actions, several things that I can do. Mm-hmm.
Wow. I read in your bio that you are originally from Saskatchewan, and you were a home care nurse there, and you worked in, outposts and out in rural areas. What was that like? And what experiences were there?
So I was born in Ontario, but I was adopted at the age of 3 months, and my family moved to northern Saskatchewan and worked up there. So growing up in Ronge, I went to Saskatoon for nurses training, of course, because Ronge is at the end of the highway, literally. And then I went back to give back to the community, reciprocate, and give my services back. So back then, ages and ages and ages ago, home care wasn't big back in the community. So in the Indigenous culture, people like to stay in their homes. It's cultural.
Mhm.
So I did have a lot of clients that I would go and check up on. And then once a month, we would go to the outpost to do mainly foot care, but also to check blood pressures and blood sugars for the trappers that were coming off their trap line for a short bit. We would kind of do an overall how you doing sort of thing and check in on them. I was pretty much, I think I had a boss that was also a nurse, but I was the only nurse that would go out and do the community visits, but we had special care aides as well that did the personal care and whatnot. So yeah, it wasn't a big thing back then, but it and obviously is bigger now, but.
Right. That's interesting. That's quite the experiences to do all that. I think that's amazing.
I loved it.
It's
That's
good to
where
give
I
back to
learned.
the community too.
That's the reason. Yeah, that was the main reason why I stayed an extra 5 years.
Wow.
Mhm.
Then what
Not
was next?
seem long, but
What came next for you?
then I moved to, while I was in Ronge, palliative care was also a new concept back then. And I did set up the palliative care program in home care while I was there. And moving to Prince Albert, Saskatchewan, when my daughter was 1, so in 1998, or 99, sorry, I worked on a palliative care unit at the Victoria Union Hospital. And I was there for a year and then moved back to Ontario in 2000.
Okay.
And pretty much did rural nursing.
That's a tough one.
That's a tough one, man.
Hard time with that word.
That was a hard one.
Rural.
Rural.
I am cross-trained, so I worked in all areas,
Okay.
med surg and obstetrics and all of it. And now in 2016, my heart decided that I had had enough, and I had a health issue with my heart. I can't work bedside anymore. So I started teaching PSWs for the colleges, and I still do that. And that's when I became a legal nurse consultant. Full-time. I had been doing it casually throughout, but full-time was 2016-17. I opened my business.
Okay.
Mm-hmm. And then in 2023, I started here at Wabano.
Yes.
Mm-hmm.
And you're working in obstetrics at Wabano?
Wabano, I am the perinatal programs coordinator. So from prenatal up until the age of 1, I create programs for community to attend and receive supports. I'm their advocate, pretty much.
So you really are from birth until death?
Yeah.
You've spanned the whole genre.
The spectrum. Yeah.
Yeah, the whole lifespan.
So when I was in the small town hospitals, palliative care is next to maternity is my passion. And working in the small town hospitals, I would be with a family while their loved one took their last breath. And then an hour later, I would deliver a baby. So I really did get one leaves and one comes. It was
a circle of life.
It was very honoring. It was an honor to be on both ends. Mm-hmm.
Wow. And it must give
I get chills on that.
Yeah, it must give you a very interesting perspective.
It
to
does.
Be so experienced with both sides of both types of care. And oh, I was going to ask you a question, and now I can't remember what it was. Well, okay, so this month was earlier this month. It was World Cancer Day, and so we know you have experience in oncology, and I would imagine that that ties in quite frequently with palliative care.
Mhm.
So I'm curious, like I've heard the term, I've been in this, working for this company now for 2.5 years. I mean, I have an idea of what palliative care is,
Mhm.
as it pertains to those with cancer, but what sort of things happen? Like what, you can't say what can you expect because everything is different.
Each person is different.
Everything is
Everybody's-
different.
Yeah.
But, you know, how as a professional, how do you do it? How do
It's
you
not
do that?
it's not for everybody, and I tell my students that. So we do a module that's the palliative care module. I'm supposed to teach them how to take care of somebody that is requiring palliative care. And I'm very straight up with them, and I tell them it's not for everybody. Not everybody can sit there while somebody is taking their last breath. Not everybody is comfortable caring for a whole family, because when you're delivering palliative care, and I also tell them that your patient is not a palliative care patient. They're not the palliative guy down in 204. They are receiving palliative care, but they are a patient with their own identity. So that's one thing that is very important to remember, and that not just nurses, but everybody in the healthcare profession needs to remember that the person in that room is not what they have or the care they're receiving. So that is one thing that I keep in mind when I am delivering palliative care, is that it's not it's the person, but it's more often in palliative care you take care of the family. It's
Mhm.
holistic. Nursing care in general changes with the times. Technology changes. There's new treatments. People that have life-limiting illnesses are living longer because of research. Everything changes. But the idea of delivering palliative care and of taking care of anyone in general really is that the idea of holistic care doesn't change, because it's always the whole person. No matter what technology you're using, it's always just the whole person. So those are the two main things that somebody that is delivering palliative care needs to always remember, is that they are their individual, unique self. Their family is who they choose that family to be. Especially in this day and age. Again, things have changed. It's not just a nuclear family.
No.
It's who you choose your family to be. And sometimes you have to bend the rules a little bit, because family's not always legally seen as who you want them to be. So you bend the rules, and family is who they want it to be.
Right. That
It's a
must
chosen
be.
family sometimes, right?
Yes. Yeah.
Yeah.
So they say you can choose your friends and you can't choose your family, but you can choose your family.
Yeah. You can choose your
Yeah.
village.
Yeah. You can
Yeah.
choose who you need your circle to be.
It's
Yes.
almost like the term family needs to change in sort of this kind of setting as well. It's more of it's my circle, it's my village, it's my, and I'm sure there are lots of people that have uh, family members that they don't want around
Mm-hmm.
at that time, and would prefer those that would support them throughout, who have supported them throughout their lives. So that must be a very difficult position to be in.
A lot of I'll use the Indigenous culture, for example, is all about community, is all
Mhm.
about taking care of everyone, takes care of everyone. You are part of a community. But when you come in from, say, up north, into Ottawa for treatment for a life. And it's not just cancer. Maybe I'll touch on that after. But when you come out of your community, you don't have anyone. So finding community and knowing that there is a community that can support you that way is also important. So having people that can find that community for you is actually part of what Wabano can do as an Indigenous organization, for example. But it's with any culture. When you're away from your family, it's not easy, for sure.
So as a palliative nurse or on a palliative care team, do you kind of become that family? Have you had in situations where you are the only one with them?
Yeah, more so, you become close to the family, but you also need to remember the therapeutic boundary that you're taught.
Right.
You're human. You're going to have tears. You're going to feel feelings. And again, what I tell my students is you have to let yourself feel. But if you're going to start blubbering like an idiot, excuse yourself into the bathroom for a sec to compose yourself.
And take
But
care.
showing tears lets that person know that you are empathetic and you feel.
Right.
You do have feelings and you are human. You're not just a robot giving the care that you've been given.
Mm-hmm.
So you being the only one, yeah, I've been the only one. I don't like it when people die alone. So if it's in the middle of the night and I was working night shift and the family wasn't able to come back, I have in the past reassured the family that they won't be alone. I will stay with them until you get here. And sometimes that getting here takes a little longer than that person chooses to wait, because people do choose when they're going to let go. They just choose when it's that kind of passing.
Right.
It's not
I hear lots of stories, right, about people, waiting till after Christmas or waiting till a family member arrives or till they leave. Because they don't want
or
them
till
there.
they have that closure themselves.
Yes.
I'll give a kind of a personal example, I guess, or I'll try to give it. If I cut off, then that means that I'm not going to be human and cry in front of you. So
it's okay to do that too.
So my dad died not too long ago, a couple weeks ago, and he ended up going into palliative care very quickly. He had liver cancer, but complications from the treatment caused him to get ill and not be able to have treatment, essentially. And his illness was inoperable, untreatable. So he ended up going into palliative care as his body said, I've had enough. And what was I can't even remember what. Oh, the final end. So after 7 nights, so on the 8th day, my sister-in-law and I decided that we needed to have a little chat with him because he was holding on a little too tight. His blood pressure was still perfect. He was still peeing. Well, the catheter was peeing for him. He had a really strong pulse. You could tell he was fighting, but his body he needed to just let go. So, and he's always been a very protective father. He was always making sure that everyone was taken care of or knew the direction where they needed to be going in life. He was always the person that you would speak to if you needed to ask some advice. So we had a discussion with him. He was unresponsive. But the last thing to go when somebody is passing is their hearing. So you know that I knew he was hearing. We had a discussion with him, let him know that we would take care of each other, let him know that we were going to be okay. That was okay to let go. He was uncomfortable. Of course, I made sure he was medicated. And then my daughter, who has a sixth sense about these things, she called and asked if she could talk to Papa.
Mhm.
Sorry.
It's okay.
It's fine.
Okay. We appreciate you sharing this one. It's so raw.
Yeah.
Thank you.
So she had a conversation with him, and then he let go. So he just waited.
He needed to
Make
hear
sure
that
everybody
voice.
was okay.
Make
Yeah.
sure. That's beautiful.
It's very
Mhm.
common, very common.
Yeah.
Oh,
Yeah.
sorry.
Nope,
It's
it's okay.
Totally
Yeah.
fine. Yeah.
Yep.
It's okay. It's okay. Tears are healthy. I think in our society we
Oh, I've had enough of those.
I know, but it's okay. You're still on your path with that. It's okay.
Yeah, and it does take, and that's another thing that families in general need to understand, that it's their own path. Everyone grieves differently. Some people are off for months after they lose a loved one, and some other people choose to get back busy into their work, and that just helps them move a little easier along in life.
Mm-hmm.
So that's another thing. Families need to understand that just because someone says, are you okay? Or don't ask somebody if they're okay. Of course, they're not okay.
No.
No.
But there's things that you can, sometimes saying nothing is say, the
best.
song You Say It Best When You Say Nothing at All.
Yeah.
It's a very accurate song when it comes to grieving.
Just holding space for people.
Yeah.
Just being
Yes.
there. Holding
Silence
space.
is very powerful.
Mhm.
And it doesn't matter. It's a universal, silence is a universal language, just as smiling is. Silence means a lot and is very powerful no matter what part of the world you come from. So silence is golden. But every family, and again, I teach this to my students, every family has their own family dance, and you have to let them have that dance. You need to maybe step into the kitchen while they're arguing, because that's not your argument to be part of. Some families get along by not getting along, and you might not like that, and you might want to say, why are you guys fighting? Yeah, no, that's their thing. And whoever is there for them doesn't need to make it their thing.
Well, and as a practitioner, we don't know what's
No.
happened in their history, so it's certainly not our place to try and
Mm-mm.
step in and do anything, right?
No. So everyone has their own thing, and you just have to read the room before you decide how you're going to react or act in that situation.
So as a daughter who went through this, watching your father battle liver cancer, was it?
Yes.
As a professional, how were you? Can you compartmentalize it, or your whole life has been dedicated to nursing, and then you're sitting there watching this happen, and is it like, how do you not be a professional while you're?
I couldn't, actually.
Okay.
Yeah, I was going to say it's kind of the other way.
Yeah, I was a daughter in maybe the last 20 minutes after he got off the phone with my daughter.
Right.
I was a daughter in that last 20 minutes. But before that, I'm the biggest advocate. When I see someone needs something in a healthcare setting, I will push everything I need to make sure, especially when it was my father. I've told people here at work that I gave the nurses 10 minutes to prove themselves and they didn't, so I stayed. so I couldn't. Everyone was like, you just need to be a daughter. No, I cope, and a lot of medical professionals cope by keeping that hat on, keeping that profession. If I'm professional, I'm trained as a professional to, yeah, I got feelings. Yeah, I have tears, but as a professional, I can stop those tears. I can just, there's something else there. I'm gonna turn and position him and make him comfortable instead of sitting here and watching him.
Well,
So
and in a way that it makes it a less helpless feeling
yes,
when you're advocating and able to do some of the hands-on care for them.
that's exactly. When my mom was passing away, the first thing I did when I got there was made sure she was a DNR, mostly because she would have been very angry at me had she come through with no hands and no feet, because she was a very active person. And had she come through the infection, she would have lost her hands and feet, but she would have also been in pain. Her whole body would have been in pain. So that part of me, and knowing the background of what could happen and will happen if this continues, also makes it easier. But on the other hand, so knowledge is power, but sometimes ignorance is bliss, because I can see what's going to happen. I know the signs that things are getting closer. And that's when I turned into a daughter. When usually it would be me calling the family and saying, I think you should come back now. So it's flipping back and forth is you can't. It's a little difficult. I mean, you can, but it's a defense mechanism, I think.
Right.
But it also lets me, having been in that situation and it lets me be a stronger advocate when it comes to other families needing the support, and sharing knowledge with them as to how they can go about making their own loved one comfortable and having what they need.
Well, and it certainly increases empathy when we've been through similar stuff.
It does.
Right?
Yeah.
I mean, not that I think in order to do what you've done in your life, you have strong empathy anyways, but I think that it would it would definitely, increase it even more, I would say, because, we tend to see ourselves in the positions as a person anyways, maybe not as the professional. I think as a professional, we try to kind of close that part off a little bit, right?
Well, teaching PSWs that are going to go into, I call it walking into the fire, because nowadays healthcare is pretty much a fire. But walking into that fire, I drill into their heads that they have their experiences, but their feelings need to remain their own, because other people have their feelings, and it's okay to have their own feelings. It's that family is allowed to want what they want. That patient is allowed to want what they want. And part of a an appropriate death, if you want to call it that, it's what the textbook calls it, is an appropriate death.
Okay.
Right? Yeah. Is a death that person wants. And one of the assignments in that textbook is getting the students to try and see what kind of death they would feel would be appropriate for one of their loved ones. And it's an assignment that it's their perception is their reality. And that's one of the good parts about living wills is learning what that person wants. It's very important to know what that person wants so that you're not redirecting your own suggestions and your own experiences on what they're going through.
Well, that can be especially difficult in cases like with a DNR or with MAID, medically assisted induced death, right?
Yeah.
That can definitely be a challenge if that's not something you believe in as a professional necessarily, but it's what your client wants. And,
Yes.
and you have to honor that. Right?
I am trained in MAID. I took the training to assist in medical assistance in dying. And I do speak to my students again very extensively about it's not your beliefs, it's not your values, and it's not your morals. But if you say no to being with somebody one time that is going through the MAID process, you are not allowed to say yes to someone else because you can't choose who is going to be using MAID. That's their choice. So if you're going to say no, you're going to say no all the time. You're not allowed to say yes and choose who you think should be allowed to partake in MAID. One thing about palliative care, one thing that has changed over even the last few years is, and it's actually part of the best practice guidelines, is that palliative care is being brought into the conversation at the beginning of an illness now. It's not, so the phrase itself is scary for family. Palliative care to many families, especially in the past, means they're dying. It's it. That's it. That's all. We got months to live. We're done. But the way things have changed is that palliative care is not, it's actually a very resourceful phrase because it gives you a team. It gives you the support. It gives you access to the people that you need that can help you. My stepmother had somebody that she could phone 24/7 if my dad had symptoms. And that's because he had a team at the beginning of his illness. Whereas if he would have waited, he would have went through all that time in a lot of pain. Well, except his daughter has a big mouth and tells them what to ask for. But palliative care needs to not be seen as something scary. It needs to be seen as a resource from the beginning of somebody's illness, and not just cancer again. It can be CHF, it can be COPD, it can be renal failure, it can be HIV, hepatitis. It can be a wide range. It can be dementia, it can be Alzheimer's, it can be whatever is the life limiting illness, but it can be received from the beginning of the illness so that you have a team to lean on instead of being super scary phrase at the end.
So palliative care could be you find out you're diagnosed with a higher level of cancer or any of the many illnesses you mentioned. And at that point, even when you are first newly diagnosed, would you be able to start having a palliative care team? Like, how does that,
so
is there some level of the illness where it automatically comes into play, or do you have to ask?
No, they'll offer it. Most of the practitioners that are versed in palliative care pretty much know the levels. So kind of the way, so when you are receiving palliative care, you could also be getting treatment, because chemo and radiation are not just used as a cure. So essentially palliative care will be offered if there's no for sure cure. For example, I went through cancer in 2021, 2022, I think, somewhere in there. It's been a while. I wasn't offered palliative care because my cancer was seen as curable. I was stage 3 and I had a very extensive treatment plan, but it was seen as highly likely that I would be able to beat it. Whereas my dad, he had an inoperable tumor
Right.
in the
Uh-oh.
yeah, we're not sure if chemo's going to work. So the likelihood of chemo working because of research said to that practitioner, let's hook him up with a palliative care team, because he can still receive treatment that will prolong or take away, because a lot of times they use radiation or chemotherapy, well, radiation mostly, to decrease the size of a tumor so that it's not pressing on other things or causing nerve pain or paralysis. So they can decrease by using the chemo and the treatment. It will either prolong your life a little bit. Maybe the chemo will make it so that it is operable. So just because you have a team does not mean you can't have the treatment alongside of that team, because of the way that palliative care is from the beginning of your illness now. You'll still be given options because that's your right. But whether you choose to accept those options is solely up to you.
So
Yeah,
now,
and I know
sorry,
that we have a comment actually in our audience, and Annie is actually a nurse, and so I just thought I should bring it forward. So true, Anita, as bringing palliative care, or as I often call it more now, comfort care, helps with managing a variety of symptoms and emotional support, hence decreasing anxiety and adding clarity during the process.
Yes.
Thank you, Annie.
So a lot of times it's not, and like you said, it's not the fear of dying that somebody, I mean, that's my ultimate fear personally, but it's for a lot of people that have come to terms with the fact that they have a life-limiting illness that in the end might be terminal. To them, they come to terms with the fact that they are going to die, but it's the process of the unknown in between that creates the most fear and the most anxiety. And
Yeah.
having people around you that are able to say, it's okay to feel what you're feeling, talk it out with me. So a good way to get past those anxieties is talking things out. Past any anxiety and any fear is talking things through. So it's not the fear of dying and the anxiety of dying, because you come to terms with that. It's the unknown. You can deal with what you know, but it's the unknown that hurts your brain.
I think many people are afraid of the pain.
Yeah.
I know in my family we have
Mhm.
somebody that is palliative, and they're more afraid of that in between. That what if it's painful than the actual. And
So in this day and age, my motto is there is absolutely no, not even a little bit reason to have pain, not even a tiny bit. There's alternative things that you can use. So when I was going through cancer treatment, I used CBD for nerve pain. I used CBD for anxiety. They kept asking me, because I should have been having a lot of pain. They kept asking me if I wanted a prescription for morphine. I said, no, I'm fine, because there's absolutely no reason at all in this day and age for pain. And being able to advocate and to understand that there's anxiety is normal. If somebody doesn't have anxiety, I'd be very worried about them. But pain increases or accentuates all anxiety because you don't know. It's the unknown, but there's no reason at all in this day and age for pain,
There are
ever.
so many options that are natural, like CBD. And then, of course, there's a slew of medications now, I'm sure, that are out there that people can choose. But yeah, it's true though. Pain is a terrifying. I don't do a lot of things. I know that I personally hold back on some things because of the fear of it might hurt. I might hurt myself because
Yeah.
that's my anxiousness. And unfortunately I imparted it on my child as well.
Yes, my daughter and I both have issues with anxiety, but we've both figured out coping mechanisms and defense mechanisms. I just use humor, but
Yes.
That's a good one though, because it really
It is.
releases the endorphins and everything, right? So
yeah.
A poorly timed joke is always the best.
That was one thing about my dad is he had an extremely high pain tolerance. So he'd say he was fine, but he would be, when you are semi-conscious, you don't know how your body's reacting to pain. So it would be believed that he wasn't having pain, but I could see by reading him, because I've been doing it for 31 years, I know a person's reactions. So that's another thing that family can help them feel useful or help them feel like they are able to do something, is to learn their loved one's body language. So they might not say that they're in pain, but when they have their eyes closed, their brow is furrowed. Like that's pain. Being agitated, cricket feet, when they rub their feet back and forth on the bed, that's most often pain, or at least discomfort. And even discomfort, there's no reason, none. Families are often scared that if they give them medication, they are going to snow them, but they want to be able to have a conversation with them. Do you want them to, so priorities, do you want to have a conversation with them and remain in pain, or do you want them to be pain-free? So the family needs to also decide at that point what's more important, what's best for that family member.
Right.
But giving the families things to look for, giving the family things to do, simple things like pressure point massages on the feet and the hands, massages, backs, pressure points, so that they don't get bed sores, fixing the pillow, positioning them, because that person knows how they've slept for the majority of their life. How do they like to be comfortable? Mouth care, teaching them how to do mouth care. It's simple, and it gives a sense of importance, because you're helping your loved ones stay comfortable, because there's no reason to be uncomfortable today. None.
If anything to take from any of these conversations, honestly, is that there is no reason to be in pain or discomfort for your loved one.
No, and it doesn't even matter what culture you're from. The culture, it's very individual. Ottawa itself is very diverse culturally. I'm a little partial to the Indigenous side of things, and I have dove deeply into the Indigenous side of culture. In the Indigenous culture, there's no word for death. It's you continue your journey into the star world. There's no Indigenous word for death, and it's not generally used. You pass on, you continue your journey. It doesn't matter what culture you're in. the end remains. The person's not going to be here, but how they make it to that part of their life is very cultural specific. But nobody, I don't care what culture it is, wants them to be uncomfortable.
Mhm.
So learning what works for that culture and the different things, smudging for Indigenous, like different things that give comfort. Learning that if you are delivering or giving palliative care to a patient, learning all about the culture is very important, and I cannot stress that enough.
And
It's
even like bringing in somebody to give a blessing or those kinds of things can bring a lot of comfort to the whole family, really, in those situations.
Yeah, I was thinking about that, like the last rites. I know Jewish culture, they have certain ceremonies that and prayers that should be said before the person can go. And I would imagine a lot of people, one of the things they wait for is for that.
Yep.
You
Yep.
know?
Speaking of the Jewish culture, one of the things, so you can be of any culture, but not be solely practicing in that culture. Does that make sense?
Yeah.
Like, you have become westernized or cityized or whatever you want to call it.
Well,
But
more and more people are having an eclectic spiritual path, right?
yes,
Right.
Where
yeah,
they're pulling stuff from
you
different
can
cultures, and
you can be of more than one culture,
Or
but
faith, yeah.
specifically of the Jewish culture, it's important for caregivers to understand that once that person does pass, you're not allowed to touch that body until the rabbi comes and readies that body themselves.
Yeah.
So it's just little tiny things like that. It's important to speak to families. You can't just assume that it's not important to them because they live in Ottawa. They don't
Right.
live. But whoever, any practitioner that is taking care of somebody that is passing, needs to remember to talk before it's too late.
It's a difficult conversation to have, but
Yeah.
truly is necessary. I know I have started talking more to my husband and my parents and his parents about what are their wants, what are their needs. It's, I mean, I see it, I listen to it every day, you know, like I think about it every day when I'm at work. So it's definitely, I don't know if it'll make it easier when the time comes, but to know what they want, to
It'll
and
make it,
be able to advocate for
yes,
what they want,
advocating is the key
you
there.
know?
So knowing allows you to advocate. Does it make it easier? No. You can have 3 years to plan for someone's death. It doesn't make it easier at all. When my father was actively dying, as the textbook calls it, I hate that phrase, but when he was passing away, my stepmom readied herself by preparing the funeral arrangements. It was her way of coping.
Right.
He knew what he wanted, and that's what she could do. And that's what she did. So, little things like that. And it didn't make it any easier. It makes it seamless and very organized. And,
Right.
but just little things.
and I would think that, if you know what the person wants, it could help support decision making,
Absolutely.
right? And so
Yeah.
that you don't have to guess, like, well, I don't know if this is what they want. I want to do what they want, but this is what I would do, but I don't think that's what they would do. But we didn't have a conversation. Like, there would be that kind of
So that's
stuff
where
that it
a
might
living,
alleviate.
you can do a living will, which it's not, a living will is not legally binding. But if the power of attorney or the loved ones, if they know what is written in the living will and they are willing to go with that, and they understand that's the wants and needs and that's important to them, it's their priority, then that helps. But if you want something legal, then you can do an advanced care plan or an advanced directive. So that includes a DNR. It includes, I want to wear the red dress. You can put everything. I started one when I was diagnosed with cancer. I didn't think it was necessary to do the whole thing, so I didn't. But it's legally binding, saying that my daughter doesn't need to make those decisions. I'm allowing my sister-in-law to help her because I don't want my daughter to have that all on her shoulders.
Right.
Anything like that can be written in an advanced care plan, and they're very helpful to the family in filling in the gaps of I don't know if they want that. So it helps. Advanced care plans and living wills do help a lot.
So when would you start writing an advanced care plan or a living will? I mean, could you do it at any time?
Yeah.
Okay.
Yeah. So if I was having coffee with you and we were talking and you started talking about what you wanted down the road, say 20 years from now, and you're writing it on a napkin, that can be your living will. That can be considered your living will. That's why it's not legally binding.
Right, because it's written on a Starbucks napkin.
It can be written on a napkin. It can be verbal. A lot of people are doing videos, like just selfie videos and explaining everything that they want. If you're watching this now means that I'm gone, something like that. But it can be, I can do it now and my daughter might watch it in 15 years because that's when she has to watch it. Whereas an advanced care plan, same thing. They're not usually people that are going into long-term care homes. It's suggested that they do this because they're obviously heading towards the end of their life. Not obviously, but it's just assumed that they're heading that way. So a lot of times that's when it's brought up. Or if somebody is known to have a life-limiting or terminal illness, that might be when that's brought up because it's legal. Everything you want is in there. But it can be done anytime. I have it sitting on my desktop if I want to finish it now.
Right.
But it is part of my will, which I did not have before I got diagnosed with cancer.
Well, I think it's when it comes into your field of awareness, right? Like we're not always thinking about the end of life in terms of, I remember when I first started in this field, I was like 20 and I came home saying, okay, so I want this at my funeral and I want this. And my family was like,
why are you talking?
Why are you talking about this? And it was simply because it was in my awareness, because I had a palliative client and they were having that conversation. And so I was like, okay, this is what I want. I want to be, and so as I went through the early years, those were things that I was putting out there. I mean, I don't think I ever wrote them down anywhere, but I definitely made it known. And I know when we did our will, I also told the power of attorney, this is what I want. And so if you have to make a decision, please make it as such. And, those kinds of things, even the casual conversations, can help in those kind of decision-making process. But certainly if it's on paper, it's easier. People forget.
I do know that when we were, because it was down in the Toronto area and I did not plan on being there for 7 nights and 8 days before he passed. And then we had a week before he was, before the funeral service, my sister-in-law and I went funeral clothes shopping. So we decided then and there that in our living will, even in our advanced care plan, wherever it needs to be written, we're having comfy clothes, slippers, Costco cake, and Costco wieners. That is going to
Brilliant.
be our funerals, because I don't want nobody going through the hassle of hating trying on clothes when
Yeah.
you just don't feel good anyway. So
So,
we both
It's
decided that. So you can
I've
decide whatever you want.
my close friend of mine, her brother-in-law passed suddenly, and he was my age, which was very difficult for all of us. I knew him, but his wife, for his celebration of life, she said, wear dad joke t-shirts, because he was known for dad joke t-shirts.
So
So
was my
yeah.
dad.
the immediate family all wore one of his shirts, and they had them on the wall of the hall and everything for his
Aw,
ceremony. And I'm thinking, yeah, that's what I don't want.
yeah.
I don't want stodgy. My stepdaughter has also said that when she does, she wants to get shot out of a cannon, so her whole body does this. I'm like I said, dark humor.
Beautiful.
That's our
Yeah.
family. But I mean, but little things like that, like I can see that, like, as devastated as I will be, I know, for any of my family members, to have that kind of lightheartedness.
Mhm.
I know that my family, my children, will definitely make it as lighthearted as possible, because of the fact that we are a family that jokes. Like, that's how we do things. That's how we show our love. But to actually be able to write it down and say, like, refrain from this, and I don't want, there's going to be crying. Of course, there's going to be crying. That's how people show emotion and sadness. But I would rather have that celebration of who I was, or who my husband was, or my parents, instead. And I think it seems like I've gone to a few recently, which are devastating in itself, but they are less formal and more
Mhm.
joyous occasions of who this person was. And so I love the celebration of life idea versus
Yeah.
funeral, because it's just it doesn't designate them as gone. It's,
Mhm.
let's celebrate who they were.
And that's the other thing. A lot of people think that an open casket gives closure. Gives closure to the people that weren't there. So it was my dad's wishes not to have an open casket, because he didn't want people remembering him the way he looked when he passed, because
Yeah.
illness had taken a huge toll on his body. I'm not going to tell you what my daughter said he looked like. But we had a close, even I didn't have a last look. I didn't need that. First of all, I was with him, but it's not necessary. And people need to understand, people that are coming to the celebration of life or the funeral need to understand that it's not, their wishes don't matter. The
Right.
person that has just passed and their family, their wishes are, the people that are coming to give their condolences or to give respect, are giving respect to the family that is left behind. And they need to understand that their choices and what that person that is coming to pay their respects, what they think doesn't really matter. So the
Mhm.
family that is going through this need to understand that you can't, first of all, can't please everyone. And second of all, those that matter don't mind, and those that don't mind matter. So they need to put their own priorities into perspective and not worry about everyone else. Because I find that the bereavement part of it needs to be more family focused for in a lot of ways. It could be more family focused. And I think that people that are going to go through this need to keep that in mind, that it's their own closure. No one else matters, really.
Mhm.
Really, we go to celebration of life or funeral to support the family,
Right.
right?
Yeah.
Because that's who's still here, and that's who needs people around them that love
Yes.
them, right?
And everyone else don't matter.
Exactly.
I know when my grandmother passed, I was very, very close with her. And my dad asked me, it was very simple. We were ending up doing a family gathering 6 months later, but we did have a viewing at the funeral home. And my dad's like, are you going to go and say goodbye? I'm like, no, I'm going to do it right here in this chair. And I'm not going to remember her that way. I'm going to remember sitting across from her playing bingo and telling dirty jokes. That's how I'm going to remember my grandmother, not in a box, because that's not who she was.
Exactly. I need to, I'm being summoned back to, I'm doing Indigenous cultural safety facilitating today. And I just got summoned back because
we are a minute over.
My turn. So. It's my turn to facilitate.
Beautiful. Well, we appreciate your time, Anita. Thank you so much for joining us. It was lovely having this chat with you. And
yeah, it was great.
I think that you brought forward a really important conversation for our
viewers. Sure.
So thank you so much.
Thank you.
It's all about family. Just keep it all about family, and knowledge is power.
Absolutely.
Mm-hmm.
And pain is not necessary.
Absolutely never. Don't even get me started on that.
It is never necessary.
Exactly.
Nope.
Thank you very much, Anita, for joining us.
Take
care
much.
and have a good weekend.
You too.
Bye-bye.
Bye.